morning. I'm Dr. Neeru Mehra, Senior Consultant, Obs and Gynae at Cloudnine Hospital, Sector 14, Gurugram. So today we are going to touch upon a very, a very preliminary topic, like what is done when you are planning a pregnancy. So if you are trying to have a baby or you are planning to start a pregnancy or family, it is never too early to start getting ready for it. See, this planning would help you to focus on things that you can do before you become pregnant so that you have a very healthy and enjoyable pregnancy. So for this, basically what we say is a preconception counseling. So whenever you are planning to start a family, you should go see your gynecologist for a preconception counseling session. So what do we do in that? So basically, first and foremost, it's a very general thing. We'll ask you about your detailed health history because we need to find out if you have any medical problem which has not been diagnosed as yet, and which can affect your pregnancy, which can be a diabetes or thyroid problem, a hypertension, or if there's any history of any genetic or any inherited problems in your family which might get transmitted to the baby. And so basically we need to optimally manage these medical problems before you enter into your pregnancy. Second is any history of medications which you are taking, because there are certain medicines which should not be taken when you are trying to be pregnant or are pregnant. So we need to see whether we need to stop those medicines, decrease the dose of those medicines, or maybe give you an alternative to get the desired result before you enter into your pregnancy. Then is your vaccination history. We need to know the immune status before you become pregnant, like your when for the tetanus injection which was given, your immune status regarding hepatitis B infection, rubella, chickenpox, all these need to be found, because any of these infections, if they occur early in pregnancy, they can have a disastrous effect on your baby in terms of congenital abnormalities. Then there is a certain lifestyle and behavior changes which you need to include in your lifestyle. Like maybe if you are a smoker, then you have to stop smoking, stop taking alcohol. If you're a coffee person, then you need to decrease your coffee intake. Then we need to find out whether the working conditions where you work, are you exposed to any toxic substances, if there is any radiation exposure. All these things we need to look into before you start with your pregnancy. And definitely you need to reach a healthy weight before you become pregnant, so as to avoid any pregnancy complications which can be associated with either your overweight, or even if you're underweight, then also you can land up with certain pregnancy complications. You need to know about your fertile period. And last, the folic acid supplementation has to be started about 3 months before you are planning a pregnancy, so that you have an adequate folic acid levels in your body. Thank you.